Anxiety is like this constant buzzing in the back of my mind, a feeling that something isn't quite right. It can creep in during the most mundane moments, like waiting in line or trying to sleep. It's that tightness in my chest, the racing thoughts that make it hard to focus. Sometimes it feels like I'm stuck in a loop, worrying about things that haven't even happened yet. But anxiety isn't just about fear. It can also be a signal, pushing me to prepare for challenges or to take action. It's a complex mix of biology and experience, often tied to stress or past trauma. Understanding it helps me manage those overwhelming moments. I remind myself that it's okay to feel this way and that I'm not alone in this struggle. Recognizing anxiety is the first step toward finding my calm amidst the chaos. Anxiety is a common mental health condition characterized by feelings of worry, nervousness, and fear that are persistent and overwhelming. It can affect anyone, regardless of age, background, or circumstances. Generalized anxiety disorder, GAD, is excessive and persistent worry about everyday things, even when there's no apparent reason to worry. Panic disorder involves recurring panic attacks, which are intense episodes of fear or discomfort that peak within minutes. Social anxiety disorder is the fear of social or performance situations in which you're exposed to possible scrutiny by others. Phobias are irrational fears of specific objects, situations, or activities. Obsessive-compulsive disorder, OCD, includes recurring intrusive thoughts, obsessions, and repetitive behaviors, compulsions, that you feel compelled to perform. Symptoms of anxiety include restlessness and feeling on edge, difficulty concentrating, irritability, sleep disturbances, rapid heartbeat and palpitations, sweating and trembling, nausea and abdominal discomfort, and fear of losing control or going crazy. Causes of anxiety can include genetics, with a family history of anxiety disorders, brain chemistry, with imbalances in neurotransmitters like serotonin and dopamine, life experiences such as traumatic events, stress, and significant changes, medical conditions, including certain health issues like thyroid disorders or heart conditions, and substance abuse, particularly withdrawal from or abuse of substances like caffeine, nicotine, or alcohol. Managing anxiety involves seeking professional help by consulting with a mental health professional for proper diagnosis and treatment, engaging in therapy such as cognitive behavioral therapy, CBT, or acceptance and commitment therapy, ACT, considering medications like antidepressants, benzodiazepines, and beta blockers, making lifestyle changes including regular exercise, a healthy diet, sufficient sleep, and stress management techniques like meditation and deep breathing, and joining support groups to connect with others who experience anxiety for valuable support and understanding. Remember, anxiety is treatable, and seeking help is the first step towards recovery. Anxiety can feel like a storm brewing inside, and its causes are as varied as the clouds in the sky. For many, it starts with genetics. If anxiety runs in the family, you might be more prone to it. Then there's the environment. Stressful life events like losing a job or going through a breakup can trigger those anxious feelings. Sometimes it's the pressure we put on ourselves. Perfectionism can create an endless cycle of worry where nothing feels good enough. And let's not forget about the role of our brains. Imbalances in neurotransmitters can make it harder to manage stress. Even our lifestyle choices play a part. Lack of sleep, poor diet, and too much caffeine can all ramp up anxiety levels. Understanding these causes is the first step in tackling anxiety head-on. It's a complex puzzle, but recognizing the pieces can lead to a clearer picture of how to cope. Anxiety is a complex condition, and its causes can vary from person to person. Here are some common causes of anxiety. Genetic factors include family history. If you have a family history of anxiety disorders, you're more likely to experience anxiety and genetic predisposition. Certain genetic traits can affect brain chemistry and increase the risk of anxiety. Environmental factors include stressful life events, traumatic events, significant changes, or ongoing stress can trigger anxiety, social and cultural pressures. Societal expectations, cultural norms, and social media can contribute to anxiety and financial stress. Financial difficulties, debt, or uncertainty can cause significant anxiety. Medical conditions include chronic illnesses. Conditions like diabetes, heart disease, or chronic pain can increase anxiety. Mental health conditions. Depression, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD, often co-occur with anxiety and neurological disorders. Conditions like Parkinson's disease, multiple sclerosis, or Alzheimer's disease can contribute to anxiety. Brain chemistry includes neurotransmitter imbalance. Imbalances in serotonin, dopamine, and other neurotransmitters can affect mood and anxiety and brain structure and function. Abnormalities in brain regions like the amygdala, hippocampus, or prefrontal cortex can contribute to anxiety. Lifestyle factors include substance abuse. Withdrawal from or abuse of substances like caffeine, nicotine, or alcohol can trigger anxiety, sleep disturbances. Poor sleep quality, insomnia, or sleep deprivation can exacerbate anxiety, and poor diet and exercise habits. A diet high in processed foods and sugar, combined with lack of exercise, can contribute to anxiety. Other factors include personality traits. Certain personality traits like perfectionism, low self-esteem, or high sensitivity can increase anxiety, learning, and conditioning. Classical conditioning, social learning, and cognitive factors can contribute to anxiety and aging and life transitions. Significant life changes like retirement or aging can trigger anxiety. Keep in mind that anxiety is often the result of a combination of these factors. If you're experiencing anxiety, it's essential to consult with a mental health professional to determine the underlying causes and develop an effective treatment plan. Anxiety can feel like a relentless storm, but there are effective ways to navigate through it. One powerful tool is mindfulness. By focusing on the present moment, we can break the cycle of anxious thoughts. Breathing exercises are also essential. Just a few deep breaths can ground us and reduce tension. Cognitive behavioral therapy, or CBT, helps reframe negative thought patterns. It's like training your brain to respond differently to stressors. Regular physical activity releases endorphins, which are natural mood lifters. And let's not forget the importance of sleep. A well-rested mind is more resilient. Connecting with others can provide support and perspective. Remember, it's okay to seek help from a professional. Anxiety is manageable, and with the right strategies, we can reclaim our peace of mind. Treating anxiety typically involves a combination of self-help strategies, lifestyle changes, and professional interventions. Here are some effective treatments for anxiety. Self-help strategies, deep breathing exercises. Regular deep breathing can help calm the mind and body. Progressive muscle relaxation. This technique involves tensing and relaxing different muscle groups to release physical tension. Mindfulness meditation. Mindfulness practices, such as meditation and yoga, can help reduce anxiety by promoting relaxation and increasing self-awareness. Journaling. Writing down your thoughts and feelings can help process and release emotions, reducing anxiety. Lifestyle changes, regular exercise, engage in physical activities that bring you joy, such as walking, running, swimming, or dancing. Healthy diet. Focus on consuming a balanced diet rich in whole foods, fruits, vegetables, and lean proteins. Sleep hygiene. Establish a consistent sleep schedule. Avoid caffeine and electronics before bedtime, and create a relaxing bedtime routine. Social support. Nurture relationships with supportive family and friends, and consider joining a social group or club. Professional interventions. Cognitive behavioral therapy, CBT. A helpful approach in identifying and challenging negative thought patterns and behaviors. Acceptance and commitment therapy, ACT, focuses on increasing mindfulness, acceptance, and values-based action. Medications. Antidepressants, benzodiazepines, and beta blockers may be prescribed to help manage anxiety symptoms. Psychodynamic therapy explores unconscious thoughts and feelings that contribute to anxiety. Alternative therapies, acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body to promote relaxation. Aromatherapy. Certain essential oils, such as lavender and chamomile, can promote relaxation and reduce anxiety. Herbal supplements. Herbal remedies like passion flower, kava, and valerian root may help alleviate anxiety symptoms. Technology-based interventions. Mobile apps like Calm, Headspace, and Happify offer guided meditation, relaxation techniques, and mood tracking features. Online therapy platforms. Platforms like BetterHelp, Talkspace, and 7 Cups provide access to licensed therapists and support groups. Remember, everyone's journey with anxiety is unique, and it's essential to work with a mental health professional to develop a personalized treatment plan. Depression is like carrying an invisible weight that makes even the simplest tasks feel monumental. It's not just feeling sad, it's a persistent cloud that dulls joy and saps energy. Imagine waking up and feeling like you're stuck in quicksand. Every effort to escape just pulls you deeper. It can manifest in various ways. Loss of interest in things you once loved, changes in sleep patterns, or even physical aches. It's a complex interplay of biology, environment, and personal experiences. Many people think it's just a phase, but it can be a serious condition that affects millions. Understanding it is crucial, not just for those who suffer, but for everyone around them. Empathy and support can make a world of difference. Depression is a complex and common mental health disorder characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities. It can affect anyone, regardless of age, background, or circumstances. Symptoms of depression include persistent sadness, loss of interest, changes in appetite, sleep disturbances, fatigue, difficulty concentrating, physical symptoms, social withdrawal, irritability, and suicidal thoughts. Types of depression include major depressive disorder, persistent depressive disorder, postpartum depression, seasonal affective disorder, and bipolar disorder. Causes of depression include genetics, brain chemistry, life events, medical conditions, and substance abuse. Treatment of depression includes medications, therapy, lifestyle changes, and support groups. Remember, depression is treatable, and seeking help is the first step towards recovery. If you or someone you know is struggling with depression, please reach out to a mental health professional or a crisis hotline. Depression isn't just one thing. It comes in various forms, each with its own unique challenges. Major depressive disorder is like a heavy fog that won't lift, affecting every aspect of life. Then there's persistent depressive disorder, where the low mood lingers for years, making it feel like a constant battle. Seasonal affective disorder, or SAD, hits when the days get shorter, leaving people feeling drained and unmotivated. Let's not forget about bipolar disorder, where the highs and lows can be extreme, creating a roller coaster of emotions. And finally, there's atypical depression, which can mask itself with symptoms like increased appetite and sleep. Understanding these types is crucial. It helps us recognize that depression isn't one size fits all, and that seeking help is a vital step toward healing. There are several types of depression, each with distinct characteristics and symptoms. Here are some of the most common types of depression. Major depressive disorder, also known as clinical depression, is characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. It can be severe and interfere with daily life. Persistent depressive disorder, also known as dysthymia, is a low-grade, long-lasting depression that can last for years. Symptoms are less severe than MDD, but can still impact daily life. Postpartum depression occurs in women after childbirth and can range from mild to severe. Symptoms include sadness, anxiety, and changes in appetite or sleep. Seasonal affective disorder occurs during the winter months when there is less sunlight. Symptoms include lethargy, social withdrawal, and changes in appetite or sleep. Bipolar disorder is a condition that involves periods of depression and mania, where mania can include symptoms such as increased energy, impulsivity, and reckless behavior. Atypical depression is a type of depression that includes symptoms such as increased appetite, sleepiness, and sensitivity to rejection. Melancholic depression is characterized by a loss of pleasure in activities, changes in appetite or sleep, and feelings of guilt or worthlessness. Psychotic depression includes symptoms such as hallucinations, delusions, and disorganized thinking. Situational depression occurs in response to a specific life event or situation, such as a divorce or job loss. Adjustment disorder with depressed mood occurs in response to a specific life event or situation, such as a move or job change. It's essential to note that everyone's experience with depression is unique, and it's possible to experience symptoms from multiple types of depression. If you're struggling with depression, it's crucial to seek professional help for proper diagnosis and treatment. Depression can feel like a heavy fog, clouding every aspect of life. It's more than just feeling sad. It's a complex condition that affects millions. Treatment often starts with therapy, where talking through feelings can provide clarity and coping strategies. Cognitive behavioral therapy, or CBT, is particularly effective, helping to reshape negative thought patterns. Medication can also play a role, with antidepressants working to balance brain chemistry. But it's not just about pills or therapy. Lifestyle changes are crucial too. Regular exercise releases endorphins, the body's natural mood lifters. Nutrition matters. Foods rich in omega-3 fatty acids and vitamins can support mental health. Mindfulness practices like meditation help ground us in the present, reducing anxiety. Remember, seeking help is a sign of strength, not weakness. Recovery is a journey, and every step counts. Treating depression typically involves a combination of self-help strategies, lifestyle changes, and professional interventions. Here are some effective treatments for depression. Self-help strategies. Exercise regularly. Physical activity can help reduce symptoms of depression. Mindfulness and meditation. Practices like mindfulness meditation, yoga, and Tai Chi can help reduce stress and anxiety. Connect with others. Build and maintain social connections with friends, family, or support groups. Get enough sleep. Aim for 7 to 8 hours of sleep per night to help regulate mood. Healthy eating. Focus on consuming a balanced diet, rich in whole foods, fruits, vegetables, and lean proteins. Lifestyle changes. Reduce stress. Identify and manage stressors in your life, such as work, relationships, or finances. Set realistic goals. Break down large tasks into smaller, achievable goals to help build confidence and motivation. Engage in activities you enjoy. Participate in hobbies, creative pursuits, or other activities that bring you pleasure and fulfillment. Practice self-compassion. Treat yourself with kindness, understanding, and patience, just as you would a close friend. Professional interventions. Medications, antidepressants, mood stabilizers, or antipsychotics may be prescribed to help manage symptoms. Therapy, cognitive behavioral therapy, CBT, psychodynamic therapy, or interpersonal therapy, IPT, can help you identify and change negative thought patterns and behaviors. Counseling. Individual or group counseling can provide support, guidance, and education on managing depression. Alternative therapies. Acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body to promote relaxation and balance. Herbal supplements. Certain herbal remedies, such as St. John's wort, same, or omega-3 fatty acids, may help alleviate symptoms of depression. Mindfulness-based cognitive therapy, MBCT, a type of therapy that combines mindfulness techniques with cognitive behavioral therapy. Technology-based interventions, online therapy platforms like BetterHelp, Talkspace, or 7 Cups offer virtual therapy sessions with licensed therapists. Mobile apps like Calm, Headspace, or Happify provide guided meditation, relaxation techniques, and mood tracking features. Remember, everyone's experience with depression is unique, and it may take some trial and error to find the right treatment approach. Be patient and don't hesitate to seek professional help if you're struggling with depression. Depression and anxiety often get tangled up, but they're distinct experiences. Depression feels like a heavy fog, sapping your energy and joy. You might struggle to find motivation, feeling hopeless or disconnected from the world. On the other hand, anxiety is more like a racing heart and a mind that won't quiet down. It's that constant worry, the what-ifs that keep you on edge. While depression pulls you down, anxiety pushes you to the brink, making you feel restless and overwhelmed. Both can be debilitating, but understanding their differences is crucial for finding the right support. Recognizing whether you're feeling trapped in a dark pit or caught in a whirlwind can be the first step toward healing. Depression and anxiety are 2 common mental health conditions that can have similar symptoms, but they are distinct conditions with different characteristics. Depression involves persistent feelings of sadness, loss of interest in activities, changes in appetite or sleep, fatigue, and difficulty concentrating. Anxiety, on the other hand, is characterized by excessive worry, fear or apprehension, restlessness and irritability, physical symptoms like rapid heartbeat, and avoidance behaviors. The key differences include mood, where depression is marked by sadness and anxiety by worry. Energy levels, with depression leading to fatigue and anxiety causing restlessness. Thought patterns, where depression involves negative self-talk and anxiety involves fear-based thinking. And behavioral changes, with depression leading to social withdrawal and anxiety resulting in avoidance behaviors. Remember that both depression and anxiety can co-occur, and it's not uncommon for individuals to experience symptoms of both conditions. If you're struggling with symptoms of depression or anxiety, it's essential to seek professional help from a mental health expert. They can help you develop a personalized treatment plan to manage your symptoms and improve your mental health.